Welcome to Infographic Psychology. What causes attention deficit hyperactivity disorder (ADHD)? The exact cause of ADHD is unknown, but the condition has been shown to run in families. Research has also identified a number of possible differences in the brains of people with ADHD when compared with those without the condition. Other factors suggested as potentially having a role in ADHD include being born prematurely before the 37th week of pregnancy, having a low birth weight, smoking or alcohol or drug abuse during pregnancy. ADHD can occur in people of any intellectual ability, although it's more common in people with learning difficulties. Symptoms of attention deficit hyperactivity disorder (ADHD). The symptoms of attention deficit hyperactivity disorder (ADHD) can be categorized into two types of behavioral problems: inattentiveness, difficulty concentrating and focusing, hyperactivity, and impulsiveness. Many people with ADHD have problems that fall into both these categories, but this is not always the case. For example, around 2 to 3 in 10 people with the condition have problems with concentrating and focusing, but not with hyperactivity or impulsiveness. This form of ADHD is also known as attention deficit disorder (AD) can sometimes go unnoticed because the symptoms may be less obvious. ADHD is more often diagnosed in boys than girls. Girls are more likely to have symptoms of inattentiveness only, and are less likely to show disruptive behavior that makes ADHD symptoms more obvious. This means girls who have ADHD may not always be diagnosed. Deciding if a child has ADHD is a process with several steps. There is no single test to diagnose ADHD, and many other problems like anxiety, depression, sleep problems, and certain types of learning disabilities can have similar symptoms. One step of the process involves having a medical exam, including hearing, to rule out other problems with symptoms like ADHD. Diagnosing ADHD usually includes a checklist for rating ADHD symptoms and taking a history of the child from parents, teachers, and sometimes the child. How is ADHD diagnosed? Healthcare providers use the guidelines in the American Psychiatric Association's Diagnostic and Statistical Manual, 5th edition DSM-5-1. to help diagnose ADHD. This diagnostic standard helps ensure that people are appropriately diagnosed and treated for ADHD. Using the same standard across communities can also help determine how many children have ADHD and how public health is impacted by this condition. Here are the criteria in shortened form. Please note that they are presented just for your information. Only trained healthcare providers can diagnose or treat ADHD. DSM-5 criteria for ADHD. 1. Inattention. 6 or more symptoms of inattention for children up to age 16 years, or 5 or more for adolescents age 17 years and older and adults. Symptoms of inattention have been present for at least 6 months, and they are inappropriate for developmental level, often fails to give close attention to details, or makes careless mistakes in schoolwork, at work, or with other activities, often has trouble holding attention on tasks or play activities, often does not seem to listen when spoken to directly, often does not follow through on instructions, and fails to finish schoolwork, chores, or duties in the workplace. For example, loses focus, sidetracked, often has trouble organizing tasks and activities, often avoids, dislikes, or is reluctant to do tasks that require mental effort over a long period of time, such as schoolwork or homework, often loses things necessary for tasks and activities, for example school materials, pencils, books, tools, wallets, keys, paperwork, eyeglasses, mobile telephones, is often easily distracted, is often forgetful in daily activities. 2. Hyperactivity and impulsivity. 6 or more symptoms of hyperactivity impulsivity for children up to age 16 years, or 5 or more for adolescents age 17 years and older and adults. Symptoms of hyperactivity impulsivity have been present for at least 6 months to an extent that is disruptive and inappropriate for the person's developmental level, often fidgets with or taps hands or feet, or squirms in seat, often leaves seat in situations when remaining seated is expected, often runs about or climbs in situations where it is not appropriate. Adolescents or adults may be limited to feeling restless, often unable to play or take part in leisure activities quietly, is often on the go acting as if driven by a motor, often talks excessively, often blurts out an answer before a question has been completed, often has trouble waiting their turn, often interrupts or intrudes on others, for example, butts into conversations or games. In addition, the following conditions must be met. Several inattentive or hyperactive impulsive symptoms were present before age 12 years. Several symptoms are present in 2 or more settings, such as at home, school or work, with friends or relatives, In other activities, there is clear evidence that the symptoms interfere with or reduce the quality of social, school, or work functioning. The symptoms are not better explained by another mental disorder such as a mood disorder, anxiety disorder, dissociative disorder, or a personality disorder. The symptoms do not happen only during the course of schizophrenia or another psychotic disorder. Based on the types of symptoms, 3 kinds presentations of ADHD can occur. Combined presentation. If enough symptoms of both criteria inattention and hyperactivity impulsivity were present for the past 6 months. Predominantly inattentive presentation. If enough symptoms of inattention, but not hyperactivity impulsivity, were present for the past 6 months. Predominantly hyperactive impulsive presentation. If enough symptoms of hyperactivity impulsivity, but not inattention, were present for the past 6 months. Because symptoms can change over time, the presentation may change over time as well. How attention deficit hyperactivity disorder (ADHD) is treated. Types of treatment for ADHD include behavior therapy, including training for parents, and medications. Treatment recommendations for ADHD. For children with ADHD younger than 6 years of age, the American Academy of Pediatrics (AP) recommends parent training in behavior management as the first line of treatment before medication is tried. For children 6 years of age and older, the recommendations include medication and behavior therapy together, parent training in behavior management for children up to age 12, and other types of behavior therapy and training for adolescents. Schools can be part of the treatment as well. AP recommendations also include adding behavioral classroom intervention and school supports. Good treatment plans will include close monitoring of whether and how much the treatment helps the child's behavior, as well as making changes as needed along the way. To learn more about AAP recommendations for the treatment of children with ADHD, behavior therapy, including training for parents, ADHD affects not only a child's ability to pay attention or sit still at school, it also affects relationships with family and other children. Children with ADHD often show behaviors that can be very disruptive to others. Behavior therapy is a treatment option that can help reduce these behaviors. It is often helpful to start behavior therapy as soon as a diagnosis is made. The goals of behavior therapy are to learn or strengthen positive behaviors and eliminate unwanted or problem behaviors. Behavior therapy for ADHD can include these approaches can also be used together. For children who attend early childhood programs, it is usually most effective if parents and educators work together to help the child. Children younger than 6 years of age. For young children with ADHD, behavior therapy is an important first step before trying medication because parent training in behavior management gives parents the skills and strategies to help their child. Parent training in behavior management has been shown to work as well as medication for ADHD in young children. Young children have more side effects from ADHD medications than older children. The long-term effects of ADHD medications on young